When Brigham and Women's Dr. Daniela Lamas isn't tending to patients, she's working on improving care for the future.
I'm part of a group that looks at communication around serious illness, and we try to devise methods to improve communication, particularly when you're having a stressful conversation, to have a clear guide of language to turn to. What was it like to learn that?
Devastating.
I'm also building this post-intensive care clinic, so a clinic for people to return to the hospital after they've survived an ICU stay, so we can learn more about what their lives are like and whether they're suffering from any of these problems: anxiety, depression, post-traumatic stress.
So you've mentioned PTSD, and we all are familiar with that in a sort of post-war environment, but how does that apply itself to patients who are leaving an ICU or a critical care environment?
The post-traumatic stress that people have, it's not that they flash back to waking up on a ventilator. It's often to these sort of horrifying nightmares that they had while they're sedated. So often they might flash back to, like, there was blood on the walls, there were bugs on people's faces. One woman told me that she believed her brain had been cut and 7/8 removed. Really, it's a reflection of the fact that what we do to and for people with the goal of getting them back to their lives is often in and of itself a trauma. I think recognizing that is hard, but it's important.
In the ICU and in her book, Dr. Lamas stresses doctors must help patients navigate difficult decisions by laying out the facts, no matter how dire. Then it's the doctor's job to listen intently and finally to follow patients' wishes.
My takeaway really is that what people are able to tolerate and sort of, what lives they find acceptable, that these are different from person to person, and they change over time, and we can't know them until we ask. And I think anybody reading the book, they can begin to think, what would I do? There's always what ifs, and there's always this sort of possibility of a miracle, but that doesn't necessarily mean that everybody is willing to go through what we have to offer to get to that possibility.
The book is really a clear-eyed and compassionate look at the choices, the difficult choices faced by both the doctors and the patients in these critical care environments, choices that many families will have to make over time. Links to the book on our website.
Great show, great reporting. That is Chronicle for tonight. Thanks for joining us. I'm Shana Seymour.
I'm Anthony Everett. We'll see you tomorrow night.